Good afternoon, and thank you for joining the Brodes H. Hartley Jr. Residency Training Program White Coat Ceremony this afternoon. Today is a very special occasion for us. We welcome our new residents into CHI, and we celebrate a very special milestone in their lives, as well as a milestone for CHI, their White Coat Ceremony. Today is indeed a great day, not just for our residents. Today, we check off one more box in the several accomplishments of CHI. Today, we are pleased to say that the communities we serve, as well as healthcare in this country in general, have a win because of CHI and because of our fearless leader, Mr. Brodes Hartley. Today is important for several reasons. We're celebrating an important transitional period in the lives of our residents. For us as humans, these transitional periods that we call the rites of passage are really very significant and very important. And they range from simple ones like transitioning of a woman or man to motherhood or fatherhood, when typically they have a child, or a cultural one like quince in the Spanish, or a religious one like the bar mitzvah in the Jewish, or the more exotic ones like when the Maasai tribe gentlemen have to kill a lion with a spear and a shield. And we cherish these rites of passage because they serve as opportunities for communities and families to share and to celebrate in an individual's progress through the journey we call life. Today we're here to celebrate you, our new residents, in this rite of passage, your white coat ceremony. And before I go in to talk about the significance of the white coat, it is my pleasure to invite our president and CEO, the person who's responsible for all of this and for your presence. And let's welcome him to the mic with a round of applause. You can take your mic.
I would like to talk about the symbol of our organization and the fact that we selected the eagle. The eagle, like physicians, are admired all over the world. But distinctive characteristics of eagles led us to this decision. The eagle has great vision. In fact, the vision of the eagle is more than 4 times that of a human being. Also, other characteristics of that eagle are versatility. The eagle can walk, the eagle can swim, the eagle can fly. And of course, that eagle can fly to great heights. And that's what we expect of our residents when they complete this program, that they will soar to great heights. But there's other characteristics of this eagle. The eagle has great strength, and he can attack prey that's bigger than the eagle himself because of the strength of his talons. The talons on the eagle that we have displayed on our logo has in its right talon an anchor, and that anchor is inscribed with faith. We are organized and determine our destiny through faith. The left talon has a caduceus, and that caduceus is inscribed with hope. And that is what our physicians actually displays and contributes to the patients that they take care of, and that is great hope. I also want to say another characteristic of that eagle is monogamous. Thank you.
All right, thank you. Thank you very much, Mr. Hartley. Mr. Hartley, our president and CEO, well, 6 years ago now, decided that it was time for CHI to become a higher educational institution for learning. He figured out that CHI had to contribute to the increasing shortage of physicians as a solution to that problem. He felt that having a teaching program would be a way of elevating the quality of care to CHI. And very importantly, he felt that having our own program will serve as a pipeline for physician recruitment, which already has become. Thank you very much for that vision, and we're really proud that we get to be a part of this. Well, this afternoon, we get to celebrate the white coat ceremony of yet another group of residents. To give you some background on white coats have always been around, and for centuries, they were used to symbolize excellence in science. And it was not until perhaps the last century or so when it was felt that medicine was not just an art, but it was also a science, and there was a need for the physician profession to begin to consider white as well. At that time, it was felt and was known that bacteria and germs were a cause of disease, and white began to represent cleanliness and neatness, and so the medical profession also adopted white. It's interesting to note that before that, black was the color of choice, a black suit, a black case, black equipment, and so this was a big transition. And it was not until 1993 when Dr. Arnold Gold decided that perhaps there should be a white coat ceremony, at which time we would attempt to bring that humanistic focus to medicine. So why must you wear a white coat? This is for you as residents. Well, for one, if you get stopped by a cop when you're speeding down the highway and your reason is because you have to get back quickly to the hospital or to the clinic, you may just get a pass. And so that might help. Wear your white coat because sometimes it allows you to go months without changing your clothes, maybe. Unfortunately, we know that the white coat can also hold tons of bacteria, and unfortunately, COVID as well. We know that sometimes the white coat can cause hypertension in patients, what is called the white coat hypertension in a lot of patients. But on a more serious note, let's remind ourselves that this white coat is a symbol of our profession. Many patients now view the white coat as a cloak of compassion and a symbol of the caring and the hope they expect to receive from their physicians. And today, you will continue with that age-old tradition. As a piece of advice, just make sure you keep your coats clean all the time, wash them, launder them. Just remember when they're crumpled, they can be seen from a distance, okay? And always have spares, okay, for inevitable accidents like coffee spills and so on and so forth. In conclusion, with the white coats we're going to give you today, we hope you see them not as a symbol of power or elitism or of knowledge, but you see them as of duty, compassion, caring, and humility. Once again, welcome to CHI and congratulations for earning the physician's white coat. And at this time, we'll begin the process of presenting the white coats to our residents. First, I would like to call upon Dr. Elizabeth Philippe, who is the program director for the Family Medicine Residency Program. She's also the assistant designated institutional official. Welcome, Dr. Philippe. We'd also like to call Dr. Tamara Wright. She's a family medicine physician and associate program director of our family residency training program. And we also invite you to the front. We will ask Dr. Wright to call the names of the residents to come into the space one by one.
Okay, thank you, Dr. Amofah.
Sign this way. I'll sign this way. You can pick up.
Ashley Furstal, Loma Linda University of Medicine.
And may we all take off this for 1 second for one more picture? Let's take off our masks for one more picture. We can do that. We need it for a long time. Congratulations.
Laura Mistela Sarasca, University of Zulia Medical School. Katina Richardson, Ross University.
I want to try one thing. Lee, you want to come in? You might just fit in here. Go ahead. Let's go. Is that okay? Next.
Stephanie Rivera Santana, University of Medicine and Health Science, St. Kitts.
All right. Thank you very much, Dr. Philippe, Dr. Wright, for the Family Medicine Residency White Coat ceremony. Now we'd like to call upon Drs. Riveron and Dr. Garcia to present the psychiatry residents. Dr. Garcia, that's right.
Thank you, Dr. Amofah. And now I would like to welcome the new psychiatry residents. Dr. Morgan Vick,
The other way. You're going to take a picture? You can take off a mask. Now, a little closer.
Dr. Gabriela Eddington, Dr. Jenny Parra, and Dr. Russell Spognis.
And we'd like to say thank you to our psychiatry program directors. Okay, at this time, I'm going to call on our CEO to make the closing comments, and I'd like to share appreciation to all of you for making this work. This is our first live-streamed and partially virtual White Coat ceremony. We sincerely appreciate your time and your effort, for the program coordinators and directors for putting this together. And congratulations again to our residents. Now, Mr. Hartley.
You're arriving at a unique experience in the White Coat ceremony at Community Health of South Florida. This is the first time that we have done a virtual White Coat ceremony. So that portends great things for you during your period here as a resident. We are so proud that you've chosen to come to the Brodes H. Hartley Jr. Teaching Health Center at Community Health of South Florida for your residency training. We anticipate that you will have unique experiences and that you will be successful upon completion of this program and secure your board certification in your specialties. Again, thank you so much for choosing the Brodes H. Hartley Jr. Teaching Health Center at Community Health of South Florida. Thank you.